Treatment of diabetes in individuals with chronic liver disease. Introduction. In India, about 80% of patients with liver cirrhosis have glucose metabolism disorders, while 30% show overt diabetes mellitus, DM. Diabetes and chronic liver disease, CLD, are common long-term conditions in the developed and developing world. The two conditions often coexist, and there are several pieces of evidence to suggest that diabetes can have a significant adverse effect on patients with chronic liver disease, leading to increased complications and premature mortality. For instance, diabetes mellitus causes liver damage by promoting inflammation and fibrosis through an increase in mitochondrial oxidative stress mediated by adipokines. On the other hand, the deterioration in carbohydrate metabolism in the liver due to fat deposition or accumulation of scarring tissues in fibrosis leads to chronic hyperglycemia. Hence, it is typical to see deterioration in the architecture and metabolism of the liver in diabetes mellitus. Therapeutic options. The treatment and management of diabetes in patients with liver disease are theoretically complicated by liver-related alterations in drug metabolism, potential interactions between the drugs, and a low, albeit real, incidence of hepatotoxicity. On the other hand, it has already been established that both chronic liver disease and diabetes mellitus have a bidirectional relationship with common risk factors such as obesity and insulin resistance. Hence, the cornerstone in treating both conditions is a healthy diet and a lifestyle modification. A hypocaloric diet is often recommended with a daily reduction of calorie intake by 500 to 1000 kilocalories. The carbohydrate consumption should be broken into portions to prevent a sudden surge in the glucose levels in the body. Another important recommendation is 45 minutes of moderate intensity exercise that can be tailor-made according to the needs of the individual. The ideal rate of weight loss is not known, but individuals should be advised to lose 5 to 10% of their baseline weight at a rate of 500 grams to 1.5 kilograms per week. On the other hand, there are several drugs for treating diabetes mellitus, such as insulin, sulfonylureas, metformin, SGLT2 inhibitors, and pioglitazone, out of which metformin and SGLT2 inhibitors have shown hepatoprotective effects to a certain extent in some patients. But they do have limitations. For example, long-term use of metformin can lead to vitamin B12 deficiency. Similarly, several studies have shown that sulfonylureas increase the risk of cardiovascular events and mortality. A 2021 study has warned against urinary tract infections, postural hypotension or volume depletion, and Fournier's gangrene due to the long-term use of SGLT2 inhibitors. Hence, herbal therapies represent the most logical therapeutic opportunity for treatment due to their hepatoprotective nature. Herbal therapy. Herbal therapy, mainly using natural antioxidants, represents a reasonable therapeutic approach for the prevention and treatment of liver diseases due to the role of oxidative stress in contributing to the initiation and progression of hepatic damage. For example, a 2018 study showed that the antioxidant and hepatoprotective activity of the aqueous methanol extract of Cichorium intybis seeds, C. intybis, protected against liver toxicity and hepatic cells from impairment. On the other hand, another study from 2020 showed that an aqueous extract of Cichorium intybis seed significantly reduced inflammation, oxidative stress, and hypertriglyceridemia. Hence, the study suggested that an aqueous extract of Cichorium intybis seeds ameliorates the disease progression, and it is beneficial as a potential adjunct dietary supplement for the management of diabetes mellitus. A 2019 study has also shown that Capparis spinosa extract not only has hepatoprotective functions but also inhibited the progression of hyperglycemia and significantly decreased body weight and body mass index. Similarly, other studies have shown that Solanum nigrum, Cassia occidentalis, and Tamarix gallica can be used to prevent liver diseases. Herbal remedies. Therefore, it can be concluded that natural compounds play a vital role in protecting human health and curing human diseases. They also have the advantages of low toxicity and a broad range of applications.